Can prostate gland structure explain prostatitis development? Imagine the prostate gland as a busy, complex factory with different sections working together. Its structure plays a key role in how inflammation and infections can develop inside it. The prostate is shaped like an inverted cone and sits just below the bladder, wrapping around the urethra, which carries urine out of the body. It is made up of several zones, each with unique features. The largest is the peripheral zone, making up about 70% of the gland, and it contains most of the glandular tissue. This is also where most prostate cancers are found. Surrounding the ejaculatory ducts is the central zone, which helps connect the prostate to the reproductive system. The transition zone surrounds the urethra and is often where benign prostatic hyperplasia, or BPH, occurs. The front part of the prostate is made of fibromuscular tissue, which is mostly muscle and fibrous tissue, and it does not produce glandular secretions. All of this is enclosed within a fibrous capsule that keeps everything in place. Inside the prostate, the urethra and ejaculatory ducts pass through, creating natural pathways that bacteria can use to enter the gland. The prostate's ductal system is quite complex, with many small channels that connect to the urethra. Because of this, bacteria from the urinary tract can ascend into the prostate, especially during infections of the bladder or urethra. This is why bacterial prostatitis, especially the acute form, is common. The gland zones also influence where inflammation tends to occur. The peripheral zone, rich in glandular tissue, is more prone to inflammation and is also the area where prostate cancer develops. The transition zone, on the other hand, is more involved in BPH, which can cause urinary symptoms. Chronic prostatitis and chronic pelvic pain syndrome are more complicated. They may involve immune responses, where the body's defense system causes inflammation without bacteria. Cytokines, which are immune signaling molecules, can mediate this inflammation. Hormonal factors, especially androgens like testosterone, may also influence susceptibility. The prostate structure, including its immune cells and hormone metabolism, can affect how likely it is to develop long-term inflammation. The fibromuscular capsule and surrounding tissue can also contribute to symptoms. If inflammation causes tissue tension or nerve irritation, it can lead to pain and urinary problems. In summary, the anatomy of the prostate, its zones, ductal pathways, and tissue composition, creates both opportunities and environments for bacteria to invade and cause inflammation. This structural setup helps explain why prostatitis develops and how it presents clinically. While the structure is a major factor, it's important to remember that immune responses, microbial factors, and hormones also play vital roles. Understanding these aspects helps doctors diagnose and treat prostatitis effectively, and it highlights why each case can be different. Always consult a healthcare professional for personalized advice, as prostatitis can be a complex condition influenced by many factors.